America's healthcare advocate, Kerry Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. My producer today, Mr. Sean Floyd. I'm your host, Kerry Hall. This is your show, America. Thank you for making us one of the most listened to talk shows throughout the United States. You know, our podcast and YouTube is just kind of exploding. We had 257,000 views on YouTube and something like 52,000 downloads on our podcast platform. So I'm going to tell you the names of these. So there's 15 of them now. So Spotify, SoundCloud, RSS Podcast, Overcast, Rumble, Stitcher, TuneIn, Pandora, Pocket Cast, Apple Podcasts, Spreaker, Amazon Music, Google, Odyssey, and YouTube. So we really appreciate this, that all of you are watching these and going up on the podcast platforms. Obviously, all of you listening on radio around the country, we greatly appreciate you. That's what we've been doing for 17 years on the AM and FM stations across the country. But this is a new thing for us. We've only been at it for about a year, and it's really quite remarkable. We actually had a client walk into a prospective customer's office in Ankara, Turkey. They had our podcast up on the computer screen, and they asked DJ Schmidt from Neuro 20, is that you on the podcast? And it was our show. So we know people are paying attention. We really appreciate it. Thank you for watching, listening, and downloading and doing all the things that you're doing. All right. If you are looking for Medicare coverage or ACA, if you're chronologically challenged and you need Medicare, you can call the lovely Joyce Thompson or Carol Lee Steele at RPS Benefits by Design, 877-385-2224, anywhere in the country. They are happy to help you if you're in Phoenix or New Mexico or Nashville or right here in the Kansas City metro or St. Louis, wherever you may be, down in Cape Girardeau. Give them a call. They can write a policy. They can help you. They can evaluate what you've got. You know, open enrollment's not that far away. If you want to take a look at that and have somebody just give you an idea of what you've got and what could work, what might be better, they're happy to do it. 877-385-2224. The website, RPS Benefits by Design, Inc.com. Also, if you're looking for group health insurance, employer-sponsored health care, there are a myriad of plans available at RPS Benefits by Design. Just call Maria Allers. She will be happy to help you. When you call up, ask for her, 877-385-2224. Or once again, the website would be RPS Benefits by Design, Inc.com. You can go up there and fill out a form and send it to them. They'll be happy to chat with you. All right, in studio with me from Blue Cross and Blue Shield of Kansas City, we are happy to have them back. Baron Roberts and Ryan Roth, welcome back, guys.
Thanks for having us,
Hey, you were just here, Ryan, not so long ago, and you're back again. So we're happy to have you guys. We've got some very interesting topics today we're going to talk about. And one of them, which we'll get into in the third segment, is important for a lot of folks around the country. 5 million of you are losing your Medicaid coverage because of changes in the omnibus funding bill that went through Congress and Senate and President Biden signed. There are a lot of changes. Medicaid was opened up during COVID, and a lot of people were able to sign up. Well, they're taking that away now. But what you don't know is about 1.5 million of you are going to qualify for an ACA Obamacare individual or family health insurance policy. It's known by a lot of different names, okay? We're going to talk about that today. And what you need to understand there is a lot of folks are going to qualify for that, are going to have premiums that are going to be zero. They're going to be very, very small. Or non-existent based on the subsidies they're going to get from the government. So we're going to talk about that because there are a lot of you out there that are qualifying. We think it's a message you need to know. We have two experts here today, and they're going to, Baron and Ryan are going to talk about it and explain what's available and what you can do. So we thought that might be helpful to a lot of folks. We're also going to talk about some other things today, and let's just start off with that. So let's chat a little bit about, the stability of carriers. We just had Humana pull out of the market. Okay. I know a lot of people are nervous. They're like, well, who's going to be next? What's going on in the marketplace? How long has Blue Cross been in business in Kansas City, Baron?
Over 85 years.
85 years. So it's been a while, right? Or as the young people say, it's been a minute. Yeah, it's been a while. So, Blue KC has always been a very stable carrier. It's been the premier carrier in the Kansas City metro in the 37 or 36 counties?
32.
Okay, 32. I exaggerated by 4. I'm sorry. In 32 counties, in and around the metro, And there are no plans to go anywhere. Am I correct? Let's get that on the table.
You are correct. We're here to stay.
And I mentioned that that Medicare, Ryan, is around the corner. Blue Cross and Blue Shield of Kansas City will be back in the Medicare market again this year.
That is absolutely correct. Yes, we're excited about the offerings we have going into 2024, and we'll get more into that as we go throughout the segment.
Yeah, it's going to be pretty remarkable, and I think you're going to be pretty happy with it. And we're going to dispel a lot of concern people have. They've seen the discussion about the cuts from CMS in Medicare. We're going to talk about that. I think you're going to be surprised that the effect is going to be minimal at most, and we'll chat about that as well. But let's go back to the stability issue. There are two things that I think people today have a difficult time with. Number one, things like Humana pulled out of the market. They're not going to do group health insurance anymore. They're going to really focus on Medicare. That's where they're at. That's going to be their market share. What they're going to do. We don't know what the other carriers are going to do. I haven't heard a lot coming out of them as well. But the stability is important, especially to people. I'm going back to Medicare again. For those of us that are chronologically challenged, as I like to say, we don't like change. Okay, so Baron, let's just talk about that. We're not expecting change from Blue Cross of Kansas City, are we?
We're not looking at any large changes, Kerry. Most importantly, we highlight and want to focus on stability, keeping plans very close to what we have today. And then I will add that we did host about 50 or so of our local brokers in-house, gathered their feedback, and incorporated a lot of those changes into the plans that we're offering for 2024 in a very positive way.
That's interesting, Ryan, because I don't know anybody else that's doing that. I mean, I certainly haven't heard about it. I haven't heard that United's doing it or Aetna's doing it or Humana or anybody else. But how important is that broker feedback?
Oh, it's incredibly important. They represent many of the members that we work with at Blue Cross and Blue Shield of Kansas City. So it's important to get that feedback so we know what it is that the market is looking for, and then we're solving for that to deliver the products that they're asking for.
So Baron, basically what you're saying is if 50 brokers sit down with you guys and say, you know what, you need to add a bigger dental benefit, or you need to change the out-of-pocket max, or you're going to take that into consideration and go back to your friends in underwriting. You're supposed to smile when I say that, okay? And say, we need to make these changes, okay? But that input goes to the top.
Absolutely. One of the advantages of being a local carrier is that we have local decision making. And so when we hosted those brokers, we brought them on site downtown, right across the street from Union Station, and gathered all their feedback, and our leaders sat in those meetings.
See, and that's important because I had a conversation with the president of one of the national plans here a couple months ago, and their feedback to me was, we'd like to do this, this, and this, and this, but we can't make any decisions until corporate makes the decision. In other words, they don't have the ability. This is something I always thought was interesting about Blue Cross and Blue Shield of Kansas City. You've always had the ability to be fast on your feet. You've always had the ability to adapt, improvise, and do the things that needed to be done. And that's not, the big carriers have problems with that. They're kind of like, a Brontosaurus out there. They're trying to figure it out, okay? And they just they're not quite nimble enough a lot of times to make the kind of changes. And that's very different here. Wouldn't you agree?
Yeah. A lot of the feedback that we get from our broker partners is that we're local, we listen, we act quickly, and behind the scenes we're working as quickly as we can to keep up with all the requests, but that is a huge benefit for us.
Yeah, it's interesting because you're working behind the scenes to keep up with the request. The fact that you're actually taking the request, Ryan, is a little different than what we're seeing with some of the other carriers. Am I right?
That is right. We want to deliver on what is the need in the market. So we're really trying to stay in touch with that and come out with solutions that help them in the areas where they have the need.
Indeed, they are. When we come back from the break, we're going to talk about customer service. This is a topic that is near and dear to my heart. I have a saying that I use these days, and that is the word service has gone out of customer service. When we come back, we're going to talk about that, and we're going to talk about why that's different at Blue KC. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. We've got more. We'll be right back. Stay tuned.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. My producer, Mr. Sean Floyd. I'm your host, Kerry Hall. In studio with me, Baron Robertson, Ryan Roth from Blue KC, Blue Cross and Blue Shield of Kansas City. We're kind of talking about a range of topics here today. We just talked a little bit about what's going on with stability in the marketplace and some of the carriers that seem to be moving around, pulling out. We're not quite sure what's going on with them. And we talked about Blue Cross being here for 85 years. We're going to talk now about customer service and why that's important. But before I do that, when we get to this third segment, which is going to be really important, we're going to be talking to people out there on Medicaid. If you know somebody on Medicaid, you got a family member on Medicaid, or it's you're really going to want to stay tuned and listen to this. But if you want information, there is a program at Blue Cross specifically designed to help people that are coming off Medicaid. How do you find out about it? You go to bluekc4u.com, bluekc4u.com. The phone number, 833-264-1596, 833-264-1596. Just call them. They'll walk you through the process, explain the subsidy to you, and tell you what you could get. It's actually better insurance than what you had on Medicaid. So just wanted to make sure you knew that. All right, so I let out by saying customer service. The word service has gone out of customer service. And I don't care who you what you may call about. I forget what it was last week. I was trying to get through to a customer. Oh, I know what it was. It was my hearing aid. I was trying to get through to the people at Phonak. I went through at least 45 minutes of trying to get on their website. I couldn't even do a chat. There was no phone number to call. There was no customer service. These hearing aids cost like $5,000 for 2 units. Okay, I only have one because I'm deaf in one ear, so I don't need 2. But having said that, I was like, seriously, they're selling a product and there's no customer service. There is nobody you can talk to. There are 29 categories of things you can click on, but that wasn't going to help me with what I needed to know. Okay, so it kind of drives me nuts because we see more and more and more of that where companies are just pulling back from customer service. That's not the case at Blue Cross and Blue Shield of Kansas City. We're going to talk about that. But before we do that, I have to tell you a story. So yesterday, my wife tells me, Kerry, you've been getting these calls from this woman named Ashley at Blue Cross, and you need to call her. But she's calling my cell phone. I said, okay, I'll call her. So I call. Ashley answers the phone. She doesn't know me, that we do radio or any of this stuff. I said, hi, Ashley, I'm Kerry Hall. I'm calling. She said, oh, Mr. Hall. Well, we just wanted to tell you that we had deducted 2 payments on your dental plan instead of 1 because of the date you have the ETF. But if you want to change that, we can change that. If you want to refund that, we can. And we're happy to do whatever you need. We just wanted to make sure you knew about it. I'm like, well, first of all, don't worry about it. And secondly, yes, we'll move the date so we don't have an issue with it. But she was extremely pleasant, more than willing to help me. And they reached out to me. They didn't wait for me to find out when I go look at the bank statement, hey, why did I get charged twice for 1 month's? The point was I talked to a human being. I didn't go through 15 voice prompts to get someone. That's not the first time. I've had issues with claims where they've been coded wrong by the hospital, whatever my wife has, and you always are able to get somebody. You just won the J.D. Power Award, Ryan. This is the 3rd time you've won it, okay? You won it in I don't know how many categories. When Gracia was here and she talked about it, and that show got a lot of listens. It's amazing. So talk a little bit about that, because this is, I think, the single biggest difference between you and the national carriers.
Yes, absolutely. We're very excited about our J.D. Power Award win this year. And really it comes down to that we pride ourselves in customer service. It is a big focus of ours to provide a high level of service to the community. And really, I think that's important for a couple of reasons. First of all, we're there when the customers need them. When I say that, everybody is here local. The customer service team, the leadership team, all throughout the organization, we're here in Kansas City. So we're in the same time zone. That's important. We're here when you need us. Secondly, I would say that we understand what you need in the market. Since we're here local, when you reference a hospital, we know about that hospital and where it's located. If you reference a certain part in town where you might need something done, we know where you're talking about and can make a good reference.
You know where the hospitals are north of the river. You don't ask what river.
We do not ask what river.
Yeah, you know, and I think that's critical. And the J.D. Power Award was for customer service, but there were 5 categories underneath that where you guys won awards. And then when Grace shows, and I cannot remember what it was, there were 2 other companies that had awarded Blue Cross and Blue Shield of Kansas City customer service. And here's the thing, okay, that I always find interesting is you actually get to talk to somebody, Baron. You don't go to voicemail. And yes, it is in the same time zone. I called a company a week or so ago, and they were on the East Coast, and I called 3 o'clock. They were closed. Okay, that doesn't do you a lot of good, right?
When you have an issue and you need something solved, calling somewhere outside of the area or outside the country is not an ideal situation.
Oh, and by the way, there are companies in the health insurance industry that have call centers in India and have call centers in Mexico. It's not real hard to figure out when you make that call, and you're trying to understand what they're saying. So having it here and having people here that, again, understand the marketplace, understand the needs, know a North Kansas City hospital from an Overland Park regional, know what people's needs are. If you're looking for an orthopedic surgeon, if you're here in Kansas City and you're Blue Cross, you know who Dixon Dively is, the largest orthopedic surgical group in the city, what they do. Yeah, I mean, those are things that are important to people when they have a problem. And when they have a problem, they want somebody to help them, right?
Absolutely. And I'll even take it a step further. We go beyond just customer service for the member. It's important to us that we deliver on service from the beginning of the process, I'll call it pre-sale, all the way through post-sale and service for the life of coverage. So that applies to the member and it applies to the broker too. We have dedicated teams to support our members. We have dedicated teams to support our brokers. And that's very important to us that they have those resources they need.
Yeah, because the nightmare for a broker after 26 years of doing this, and I don't do it actively like I used to anymore, but the nightmare for the broker is when the person calls because they're angry they couldn't get a prescription filled or couldn't get pre-certed for a surgery or whatever the case may be, and they get 15 voice prompts from the carrier and nobody wants to talk to them. And I used to have a commercial that I said you can call the 1-800 I don't give a damn number, or you can call because, yeah, you're shaking your head, but I'm going to tell you something. Try some of these companies and see what you get, Baron. I mean, it's so clear that there's no, what it is, it's cost cutting. They don't want to pay to have, you're sitting there, you're shaking your head, right? They don't want to pay to have people sitting there answering those phones, taking care of those problems. And yeah, it looks good on the bottom line, but it doesn't look good when it comes to customer retention. It doesn't look good when the brokers are out trying to promote that product and they know that they're going to be able to get the kind of customer service they need at Blue Cross, but maybe not so much at one of the other carriers. That's the difference, right?
It is. It is. And while cost is important, there's nobody that will say it's not. That's very important. We focus on that. But it's also important to have a good experience as you're dealing with insurance. Insurance can be complicated. There's lots of things that can go sideways in insurance, and we want to make sure you have the resources there for you when something, it's not if it's going to go wrong, occasionally it will go wrong, and we're there to help walk you through that journey.
Yeah, I always used to tell them it's not a question of if you're going to have a problem, you're going to have a problem. Whether it's going to be a provider problem or a prescription drug problem or a coding problem, it happens, period, okay? So do you want somebody that's going to be there to take care of it, or do you want to play roulette? And that's the big difference. We're going to come back in this next segment. If you're on Medicaid, you want to watch this podcast, you want to listen to the radio show, this is going to be really important to you. We're going to tell you how to get coverage that you probably didn't even know you could get. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. We'll be right back. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can find out more about us by going to the website America's Healthcare Advocate, or one of those 15 platforms, 14 podcasts, 1 YouTube. If you want to watch the show, listen to the show, they're all videoed now. They're all put up there. Our producer, Dave Thiessen, man behind the camera, does a fantastic job of putting all this together. And Sean Floyd, my producer here in the Odyssey Studios, does a great job on the radio side. So if you want any information, go to the website, americashealthcareadvocate.com. In studio with me, Baron Roberts, Ryan Roth from Blue KC, Blue Cross and Blue Shield of Kansas City. Now, this is a segment we're going to talk about Medicaid. We're also going to talk about Medicare and some of the rollout this year for Medicare Advantage. But I want to give this website out again. You're out there, maybe you're in Bethany, or maybe you're up in Trenton, or maybe you're here in Kansas City and you're a Medicaid recipient. There are a huge number of Medicaid people out in the rural communities. Go to the website, bluekc4u.com. bluekc4u.com. Go to the website. The Medicaid information is up there. Learn what you can get, and you'd be surprised. It's going to be a zero premium or a very small premium, depending on the subsidy. They will calculate that. You don't have to do anything. All you have to do is reach out and ask for help. Phone number 833-264-1596, 833-264-1596. Give them a call. Let them help you. All right, let's go right to this. So I said in the opening segment, 5 million people are being kicked off of Medicaid. That's it, okay? Of that, 1.5 million will qualify for ACA. Of that 1.5 million, I'm going to guess that 90% haven't got a clue that they qualify for it, because nobody is talking about this. It's not in the media anywhere. I don't see any advocacy for this any place other than you guys coming on here, and we're talking about it. We're putting it up on the podcast platforms. We're going to put it out there. But so let's just talk about what's available. Let's start. Baron?
Yeah, Kerry. So we've got 11 ACA plans available for people. As far as resources go, you hit the nail on the head there. BlueKC4U.com, or our phone number you mentioned. We do see a big opportunity here for folks that are losing their Medicaid coverage. We do see there being between 6,000 and 9,000 people just in the state of Missouri losing Medicaid coverage every single month.
Wait, do that one more time. How many?
6,000 to 9,000
a month.
A month.
That's pretty serious, folks. 6,000 to 9,000 people. We haven't even talked about Kansas yet. So let's keep going.
Yeah. So we do see a lot of disruption there, and what we are anticipating is folks that, as you mentioned, there's not a lot of communication going out. I think the state's sending information. The Medicaid TPAs are sending information, but it's typically by snail mail. It's very difficult to get a hold of some folks these days with mail. And we anticipate most of these people will find out when they're in the ER or when they go pick up their prescriptions.
And that's the scary part. What Baron just said is the part that is the scariest part. Most people aren't even going to know, or they get that thing in the mail and they think, oh, it's junk mail, and they throw it in the trash. They don't pay attention to it. And then you show up and you need care, and the hospital goes, I'm sorry, we're not accepting your card because it's expired. You no longer have coverage. You didn't even know, right?
Yeah.
It's not being communicated well. I mean, there's been a lot of discussion about this behind the scenes. CMS and other people, the responsibilities have fallen on the states. A lot of the states, they just aren't doing a good job.
Well, it's a big undertaking and a very short runway that they're working with as well. So I know that they've been working really hard to get file feeds updated and stuff like that to be able to communicate with the TPAs that handle the Medicaid for them. But it's a mass communication campaign, and there's a lot of effort going into it right now.
So, Ryan, talk a little bit about, and this is all right, I'm hearing this, okay, I've got a Medicaid plan. I make $60,000 a year. I'm a single mom. I got 2 kids. Talk about what typically that mom would qualify for. We need to get into the numbers in detail, but how that mom would qualify for an ACA, Obamacare, individual health insurance plan, family plan for her and for her kids.
Yeah, so if you go to bluekc4u.com or call us at our 800 number, we will walk you through a calculator that shows you what subsidies are available for you, what plans are the best fit for you, regardless of your income level. The scenario you gave, somebody making less, somebody making more, we'll walk you through it in detail, your specific situation, and help you determine the plan that's right for you.
But the subsidies, especially if you're under $100,000 a year, they're going to be significant.
Yeah, we anticipate, just given the consideration that someone has qualified for Medicaid previously and is losing Medicaid coverage, we do expect there to be substantial subsidies to help offset those premium dollars.
And some of them are even going to qualify for lower deductibles, aren't they, as a result of, depending on their situation? Isn't that correct? No? I thought there was another plan out there where they would, it's like kind of on top of the ACA plan. If they're coming off this Medicaid, there may be a situation where they...
Yeah, it's very possible. We don't want to get into the details for somebody that might be inaccurate, but if people do want to reach out to us, we'll walk them through in detail all their options, compare it to what they had so that they understand what they're getting.
So this is really the reason I did this today, and I wanted these guys in here for this show. This was the primary reason I wanted to do this today, because this is a huge problem. And you heard Barron describe it. Yeah, the states are trying to communicate, but they're not doing a great job. And the third-party administrators that are handling this, they aren't doing a great job either. And unfortunately, a lot of you're going to find out about it, just like Barron said. When you walk into the urgent care, the ER, to get your prescription drugs, and you say, I'm sorry, you haven't got coverage. There's a simple way to find out and get help, okay? That phone number is 833-264-1596. 32 counties. Did I get it right this time?
Yes, sir.
Okay, 32 counties in and around Kansas City. That, by the way, we talked about Missouri. Wyandotte and Johnson County, okay, if you're a Medicaid recipient in either one of those areas and you need help to figure out how you're going to get coverage, call that number, 833-264-1596, or go to the website, bluekc4u.com. It's up there, okay? You can go see everything. You heard Ryan say, just call them. They'll be happy to talk to you. They'll walk you through it. You don't have to do anything. They'll walk you through the whole process. So I just think it's really important that people get this. And like I said, I think 90% of the people haven't got a clue that they can qualify for the ACA. I don't think that's being communicated to them.
I'll take this one. Yeah, it's not even on a lot of people's radars. They're going to be surprised when they get the letter in the mail or when they go to the doctor and realize they don't have that coverage anymore. And it's not something that people tend to be really informed on. You buy it and you set it to the side and think it's going to pay. And then when it goes away, it can be a shocker. So it is important that they get ahead of it if they can. So if they get the notice, please reach out to us so that we can get ahead of it before you do need some sort of service. That is critically important.
All right, so that he just said something really important there. You didn't get the letter, or you haven't heard about this, or it hasn't happened. Call. They'll tell you. They can tell you if you're on the list. Give them a call. 833-264-1596. Let's switch gears a minute and talk a little bit about rollout and what's going on there. This is for Medicare Advantage, so we're changing topics, folks. Stay with the program. Okay.
Well, our rollout meetings, are we talking about rollout meetings?
We are
for Medicare Advantage, individual ACA, and small group. So we'll have meetings that cover all. So our rollout meetings begin August 31st is our first meeting, and that's a broker-specific rollout meeting. So brokers are invited to those meetings.
And where is that one going to be held?
The one on August 31st, Barron, do you recall off the top of your head?
Got them all memorized. Pinstripes in Overland Park.
Oh, Pinstripes. Okay. I've been there. Yes. And then you can go bowling and learn something. Okay.
At 10 o'clock, we will cover Medicare Advantage updates to bring everybody up to speed on what will be offered in 2024. At 11 o'clock, we cover individual ACA updates. And then at 1 o'clock, we cover everything small group updates.
So if you're only a Medicare broker, all you do is Medicare Advantage, Medicare Supplement, you can go to that one segment.
That's right.
If you're a broker that does ACA, but you don't do Medicare, then you can go to that segment. If you're a broker that does all three, you've got 3 hours to learn everything that you've got. That's pretty in-depth. You have not done it like this before. This is really great.
Yeah, we have in different versions,
right? But not like
ways,
this. Not all.
Yeah, we've learned over time how to consolidate.
Listen to those brokers again.
Get it right. So we're trying to get that education out there for the broker community. So we have sent out invitations to brokers, and we're asking that you do RSVP so we have a proper
Limited
count.
number of seats.
That's right. And know who is coming. And if you haven't received it or have lost that, you can also call us at the 800 number Carrie mentioned earlier, and we will get you on the reservation list.
What's the other date? Is there another date besides
there's
August?
August 31st, September 5th, and September 7th.
So September 5th is Union Station in the boardroom. Same time schedule of same topics. And then September 7th is at the View at Briarcliff up in Parkville.
All right. When we come back from the break, we're going to talk about another event on September 14th. This is kind of the Super Bowl of broker events that Blue Cross and Blue Shield is going to be putting on September 14th. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. We'll be right back. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the fruited plain here on the HIA Radio Network. My producer, Mr. Sean Floyd. He is the man behind the microphones, making sure this all works. And man behind the camera, Dave Thiessen. Are in studio with me, Baron Roberts and Ryan Roth from Blue Cross and Blue Shield of Kansas City. We're talking about all things Blue KC. We've covered Medicaid. We've talked about a little bit about Medicare Advantage, what's going on with the brokers out there. We've talked about customer service and some of the other issues so that folks know Blue KC, been here for 85 years, not going anywhere, neither are the plans, okay? And I'm going to go back in this segment now. Before I do that, again, I'm going to give out this phone number, 833-264-1596. If you're one of those people out there that may lose that Medicaid coverage, you need to call them or go to the website, bluekc4u.com, bluekc4u.com. All right, so there's one more event after the three that we talked about. So we got August 31st, September 5th, and September 7th. Okay, those are the multiple topic events. Then we've got the Super Bowl event. Okay, I'm going to name this. Okay, this is going to be held in the Overland Park Convention Center, and that's going to be on September 14th. Okay, Baron, let's hear about it.
Yeah, so we're really excited about this event. This is the first event of this type that we're rolling out. That event will be really centered on bringing our broker partners in for our Medicare Advantage and ACA. And it will allow them the opportunity to meet and discuss with our vendors that operate behind the scenes for our Medicare Advantage and ACA products, how they work, how they operate, what are the things that go on behind the scenes so that our broker partners can really explain all the different things that occur to the members that they're working with.
That's going to be pretty exciting. I mean, I know you're listening to this, people, and you go, what is it? How could that be exciting? The fact that they're going to get to learn all of this information. And here's why that's important. Because when they talk to you, you're the client, okay? They're going to know, okay, this is where you can go to get your glasses. This is where you can go for hearing aids. This is where you can go for physical all of these things are going to be there, so the brokers will have insight to that. That's pretty important, okay, when you're making a decision. You know, what are the networks like? Who's going to be covered, all the rest of it. Okay?
Yeah, absolutely.
So September 14th at the Overland Park Convention Center, RSVP?
Yes. So we sent an RSVP link to our broker partners. If they didn't get that link, as you mentioned, call that number and get on the list.
And that number is the 833-264-1596. If you call that number, you can definitely get on the list. You know, you're a broker out there or you're an agent out there, you really do need to go to everyone. You need to go to one of the three that are the multi-topic ones, and you definitely need to go to one on the 14th if you're involved in Medicare Advantage. So I think that's pretty important for folks. So let's talk a little bit about, we're going to be in the Medicare Advantage space next year, right?
Absolutely.
Okay. So we probably can't get into a lot of detail, but there was a lot of panic, okay, when the media was talking about multiple cuts are coming to Medicare Advantage plans because CMS is reducing reimbursement. And the newspaper articles and the media were, all about this. The story in the media was there's going to be a 3% cut. That's been pushed back now to 1% over 3 years. How's that going to affect Blue Cross in terms of what you're going to roll out for MA next year? What are you anticipating? I know you can't talk specifics, but because you can't talk about it until we get to open enrollment, but what are you anticipating?
Yeah. So, with that news and on the legislation, all the changes that are coming, we thought it was very important to remain stable. And
there's that word again, stable.
Stabilization.
Yeah.
Be an affordable, stable product that's out there for people.
So there are not going to be any giant shocks, Ryan, coming out of Blue Cross. And I'm doing this because, seasoned citizens pay attention to this stuff, okay? Those of us that are chronologically challenged, as I like to say. And, one person talks to another. Have you heard about the cuts and, what's going to happen to our Medicare? I've already gotten phone calls from people about this. Literally, I've gotten phone calls from people that are worried about what's going to happen. I think it's important to understand you're not looking at substantial changes in Blue Cross and Blue Shield of this year.
That is correct. There will not be substantial changes. We worked very hard, as Barron's referenced, to keep the portfolio stable, deliver the benefits people are used to.
Yeah, and that goes back to this conversation about, first of all, we've got the people right here in studio. Okay, they don't have to go to corporate, in Minneapolis or in Memphis, Tennessee, or someplace else to get an answer to this. Okay, they're right here, and Blue Cross and Blue Shield is the word stable is going to continue to produce the Medicare Advantage product this year, the Medicare Supplement product. They're not anticipating changes to this that are going to impact people in any significant way. So I think you're going to be pleased with what you see when the products roll out. When will we start seeing products roll out? What's the date?
Yep. So as far as for our broker partners, we have our rollout events. We'll be sharing some benefits then. And then as far as for the members, the earliest we can release product details is October 1st. So right about that time, it's a good time to give us a call, ask us questions about the products, and you'll find out then.
Yeah, and you can do that. You can do that now. You can give them a call, get on the list, and they will call you. Or you can go to your broker, do the same thing, get on the list, and they'll be happy to call you and advise you of, as soon as we know, we're going to get right back to you. So you're not waiting and worrying, how is this going to affect me? What's it going to affect, et cetera, et cetera. Last topic before we close it out today, network strength. What's the network going to look like this year? Are there any substantial changes to the network?
Yep, no substantial changes to our network.
Okay, so that's important. Let's talk about who's in the network on the Medicare side this year. So we've got KU Medical Center.
Yep.
We got St. Luke's in there.
Yep.
And is HCA in there this year?
Yep.
Okay, so that's it right there. Okay, those are the three major players. You've got KU. If you don't recognize HCA, that would be Overland Park Regional. That would be Research Medical Center, Menorah, et cetera, et cetera. You all know St. Luke's North, South, East, West, et cetera. And KU, now part of Olathe and all the rest of it. So basically, you've got blanket access in all networks across the metro, in and around the metro for coverage if you're on the Blue Cross and Blue Shield plans. Boy, that was a lot of information today, guys. Kind of like drinking out of a fire hose in here today, but I think we disseminated a lot of good information out to folks out there. Once again, any questions, Medicaid, whether it's, you're worried about Medicare or whatever, 833-264-1596, that is the phone number. They are happy to chat with you and help you in any way that they can. And I really do urge you, if you're on that on one of those Medicaid plans, take the time to make that phone call. You heard Barron say it, you heard Ryan say it. Don't wait till you walk into the ER, the urgent care with your child, and you've got a major problem and you find out you don't have care. And now you got to figure out how you're going to pay for it. Because even if you didn't get the letter, okay, get on the phone and give them a call, 833-264-1596, the website bluekc4u.com. Thanks again, guys.
Thanks for having us.
And now I leave you with this thought, ladies and gentlemen, from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words were never spoken. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. We'll see you next week. Goodbye, America.